In a continent where the population is 19 years or young, the lack of access to robust mental health care is something that strikes me as a roadblock to young people being able to succeed. Thank you guys so much for coming. My name is Tom, in case we haven't met. And yeah, I just wanted to, really welcome you guys to this event. Shamiri Institute is a data-driven nonprofit organization whose mission is to develop and disseminate evidence-based interventions for young people in sub-Saharan Africa and beyond.
Our programs will really help the youth by getting into their minds and knowing what they think, making them feel that someone actually cares about their mental health, and this in turn will help them improve in even other aspects of their lives.
Shamiri has had many programs, some of them which have already taken place, some of them which are already about to take place. The impact of our programs improves students or adolescent, high school going students' academic performance, their character strengths, for example. Basically makes better the social life of the students.
Mental health is a really important challenge that's facing a lot of youth today. And seeing as these challenges are really fundamental to a lot of other really important life outcomes, I think the mission of Shamiri is really worthwhile, and also one of the main challenges facing our generation today, and that's to provide at-risk, low-income youths with a chance to really achieve their life outcomes through our interventions.
If you look at Africa's demographic, the median age is right about 18. So the figures show that we are working with a critical mass of youth. And I believe that this leverage is very important for the work that we're doing. Finding the students where they are at their schools, where they spend most of their social life and also academic life as well. So the biggest motivation here is the leverage that is the young people.
Our flagship program, called Project Thrive, is a simple, scalable, stigma-free and school-based mental health program that has been shown to improve adolescent mental health by reducing depression and anxiety symptoms, as well as improving peer relationships and academic grades in rigorous gold standard field experiments.
Being a Thrive Fellow affiliates me to Shamiri, whose one of the main objectives is to, promote positivity and also spread mental growth and mental health and mental fluency all over.
I happen to have this friend who was struggling with mental health issues, depression to be precise, and it got to a point where she even got suicidal. I couldn't know how to handle it. So I think Thrive Fellowship is a good opportunity for me to learn more about mental health and how to deal with it, how to help people get through it, because for me it's very important to actually offer solutions to people.
My motivation was one of the kids who gave me a feedback saying that I brought, he mentioned my name specifically among other fellows. So he told me that I brought something new to him, and I've changed his life in so positive way that he's looking forward one day again to also give back to the society just the same way as I have done to him.
The Shamiri intervention through Project Thrive has been shown to reduce clinical symptoms of depression and anxiety, to improve perceived social support among one's peers, to improve so many other metrics of holistic life outcomes and academic outcomes, which are so important.
Teenagers, they are afraid to talk about what they feel, but now in my ideal world, I want them to be free to share what they feel, and also know that there is a place where they can go and get help or treated, and also have someone to talk to when they have problems, and this will help us to curb and reduce cases of depression. Yeah.
People say Africans don't get depressed. I can't be depressed because I am an African. But the truth is, there is depression. People are anxiety in Africa. So in my ideal world, people would talk freely about mental health. People would seek after mental health care freely without hiding their loved ones who are suffering from mental health care. In my ideal world, mental health care would be readily available for people who need it. And basically there would be acceptance, no judgment on people who are suffering from mental health.
At Shamiri, we believe that young people in Africa can't be able to actualize their potential if we put them at the forefront of the work that we're doing. And so because of that, we are trying to build and design tools and mental health tools that can be able to meet young people at their point of need and really set them up nicely on a platform towards success. I invite you today to amplify our work. From supporting our work to volunteering and collaborating, you can get involved in helping make a difference in the kind of work that we're doing. Consider donating to our cause today. Most of our work is actually funded by small donations from people around the world. You can also just do something as simple as also just following us on social media.